I must say at the outset that it is an excellent opportunity to interact with you, and thanks to the technology that we are meeting today on an evening. And I must give all the compliments to the organizing team of Association of Surgeons of India, Nagercoil City Branch, and special thanks to Dr. Shiva Kumar for giving me, honestly, the first opportunity to have an oration on Zoom. It is a virtual oration. We have been invited in person to do lot of orations, but this is the first oration which I am delivering on Zoom on webinar, and that will be recorded throughout. And I am very, very thankful again to all the organizing team and of this association. You are doing an excellent job. All of us have seen that. And I wish great success in all your endeavors. And I must give my compliments to especially the younger ones who presented the case today and did a beautiful job. I bring greetings from Bhatia Global Hospital and Sir Gangaram Hospital. And I will be devoting next 45 to 50 minutes on the topic which is very, very close to me, and that is there is safety in more safety. I think in this COVID era, I would call this as COVID era, most important aspect is safety. Safety for ourselves, safety for our family members, safety for all our patients, and safety for the city, country, world, and globe, and so on and so forth. So I think the most important lesson which God wanted to give us is that we have to work in such a manner that the protocols work and ultimately we remain safe. And this kind of safety should be transmitted to our patients also. The most dangerous phrase in the language is that we have always done it this way. And in this presentation, I would be again and again emphasizing the role of safety. And believe me, there is a small story. As you know, that many people were discussing with me before the start of the Zoom session, that I have been writing the motivational stories in our global newsletter. And the small story is that there was a person who was carrying his son on the shoulder, and he was on a tightrope walk, and he was walking from one tower to another tower. And as he was walking, people were surprised that how can a person carrying his small son on the shoulder, and he is walking on a tightrope, and he is able to balance with his two hands, and it is too high the towers are. But as he walked and ultimately reached the other tower, everybody clapped. Most of the people took selfies with this man, and then said that you have done a great job. We must admire that you have done a beautiful job. He said that, do you trust me? The people said, yes, we trust you. He asked that, do you think that I can go back from this tower to previous tower again? Everyone said, yes, why not? Once you have done it this way and you have done it so beautifully, you were carrying your son on your shoulder and you have been able to reach this tower, we trust you. We definitely trust you. He says that if you trust me so much, is it possible that I can have your son on my shoulder and then I can go back? And now everyone started thinking that, is it safe or not? Should we believe it or not? Should we have the trust or not? So thinking is, why did I tell this story? That ultimately there is a difference when we are working for our family members and when we are working for others. So thinking is that if that kind of trust can be built in the minds of the patient, I think there is absolutely clarity. Once the patients start trusting you and we start reciprocating the same trust because of our protocols, because of our safe practice, then they will also be able to give their children on our shoulders, and we can definitely walk from one tower to another tower. I am not going into much details of the COVID, which all of, and it has been emphasized that all of us had never ever anticipated this kind of phase in our life. Nobody had globally. At least 500 doctors, for example, have been infected in Mumbai itself. In Delhi also, such grim situation is there, and all of us are fighting for the safety of our own, our family members, and then the country. But and now one battle, one war which was going on was with Corona, but another battle has started about the administration. And then Health Ministry today itself, this is a publication from today itself, the Health Ministry tells the Supreme Court that final responsibility is on healthcare workers to train themselves and be safe from COVID-19. So thinking is that yes, we have to believe on this, that there is safety in more safety. This is a excellent publication from Annals of Surgery, and it was in January 2020 that should zero harm be our goal. At that phase, when obviously this COVID era had not started, or it had started in Wuhan only, this publication was there that should zero harm be our goal. And again, one has to carry on thinking about two aspects: quality versus safety. Quality is the avoidance of a negative, safety is an avoidance of a negative outcome, and quality is the achievement of a positive outcome. So one has to make sure that we have to marry the safety as well as quality. I could see Dr. Shivaram's hospital, which had started in 1998 from a small, humble beginning, but he has reached that level. Now he has included the endoscopies and bariatric surgery and laparoscopic surgery. It is fantastic. Again, I must apologize for a negative connotation. Why I am speaking on this topic of there is safety in more safety, because this symmetry stone definitely touched my soul. And it is written that Mr. So and so, Deputy Superintendent of Police, father of so and so, had died because of the negligence of so and so hospital. So if that kind of situation has come, that people have started putting the stone in the cemetery, I think the movement has already been there. One move can start a movement. Can you imagine that these people in Odisha village, they are carrying a banner at the funeral of somebody that she has died because of the negligence of so and so doctor. So thinking is that somewhere we should introspect, that somewhere there is a loss of trust which we had been enjoying for ages, for decades, but now that trust is missing. That belief and trust, definitely we have to rekindle that. And we had seen this kind of story in Assam when an elderly doctor had been beaten to death after the worker had died. Similarly, so much of, I would say, media presence of these kind of stories are there, but I'm not going into the details of it. But I would definitely love to go in a positive mode, that, for example, now are you able to see that in this Formula One racing car, the driver has just a few seconds to change the tire, fuel the car, and the team has to do the best. For example, if any one member of the team says, "Sorry, sir, I could not change the tire or I could not fuel the car," the pilot is dead on the track. So thinking is that we as surgeons, we definitely are the captains, we are the pilots. So we have to work on a team, and then only we will be able to deliver the best. And I could see the beautiful teamwork when all of your members and your organization, that one could see that cases were also presented, then oration is also there, and chairperson, the secretary, everyone had a presence here today. Now, in this, you can see the photograph of Senna. Senna, he died in a Formula One racing car in 1994. And can you imagine, the president of the Association of Formula One racing car had vowed that very day that failure is not an option. If a young person dies on a track, this should never ever happen again. And so much of safety precautions were taken after that. And you know that what is the level of Formula One racing car today. So same way, if our presidents of Association of Surgeons of India, as our governing council, if we also, and we have been doing it, we are focusing on safety, then failure is not an option. We should definitely work in such a way that we want that every patient is our son or daughter or father or mother or sister. Then only we will be able to get back the same trust which we had in the initial phase. Edwards Deming had beautifully summed up, "In God we trust, all others must bring data." And can you imagine, in last February 2019 in Lancet, they had analyzed the global burden of post-operative death. We, the surgeons, I am not going into the COVID deaths at the moment. I will not be speaking anything about it. But before that era, the global burden of post-operative death was that this was the third greatest contributor after ischemic heart disease and stroke. The maximum number of people who died in the world was because of the ischemic heart disease, then the stroke, and then the post-operative death. That means 7.7% of all the deaths were because of the post-operative care. And the analysis revealed that the medical errors are the third leading cause of death in the developed countries, also in, for example, in USA. And this was a publication in which they had shown that every year, for example, total surgical procedures were of the order of 313 million, but total deaths within 30 days were of the order of 4.2 million. Means that more people were dying within 30 days of surgery annually than combined HIV, malaria, and tuberculosis. So thinking is that we should introspect every minute that in what way we can become safe. And if there is a safety, there is safety in more safety. Similarly, it has been reported that approximately 44,000 to 98,000, these are the numbers from the developed hospitals. In America, they die in hospitals as a result of errors in care. And the complications after surgery occurred in approximately 25% of the patients, and crude mortality after major surgery is of the order of 0.5 to 5%. But the most important aspect is that half of these deaths had been occurring because of the surgical care. And half of the deaths which were occurring were preventable. And but most common analysis which was done was that all said and done, human mind is human mind. Even if we have developed so much, but the principles of surgical safety were inconsistently applied even in the most sophisticated settings. And that is the reason that still people are still dying, and because of the surgical. And 3 to 4% are harmed by the care which is supposed to help them. 7.7% are exposed to a serious medication error. Why I am highlighting this is that whether we are sitting in New Delhi, whether we are sitting in Nagercoil, whether we are sitting in New York, we have to analyze ourselves that how can we improve. Can you imagine that the Joint Commission had done a statistics analysis, and survey was done, and in which it was found out that each year 1,500 to 2,500 wrong site surgeries are done. And when the survey was done, approximately 21% of more than 1,000 hand surgeons reported at least once they had done a wrong surgery. Would you be surprised that surgery, and that too hand surgery, and 21% of 1,000, more than 1,000 surgeons believed that they had done a wrong surgery? And why? The safety of the science of safety has matured, and why these have been happening. I think we should go into slighter details about, because of the communication breakdowns, because of the diagnostic error, because of the poor judgment and inadequate skill set. So thinking is that we have to make sure that either because of omission or commission or error of execution or error of planning or deviation from the standard of care, one does harm the patient. Can you imagine? I did not want to portray this, but this is a young lady who had presented in one of the periphery centers, and then ultimately she was referred to All India Institute of Medical Sciences. I'm thankful to Dr. Arvind Kumar for sharing this slide. Can you imagine that she had presented with gastroenteritis, and at that place outside Delhi, they had given the IV fluids, and after the IV fluids, she developed the peripheral. You can see the picture of all the four limbs, though she was saved. But can you imagine, when in retrospect, the analysis was done, they found that in the IV fluids, there was an ergot, and that had caused such a disastrous complication. Similarly, this is one of the major hospitals in which some surgery was done, but because of the mask, one can see that maybe ETO was not done, or maybe the chemicals were sticking on to the mask, and that had left the mark on the patients. So our thinking is that don't practice until you get it right. Practice until you can't get it wrong. I think this is very, very important in today's era, all the more that we should tell our younger colleagues also that decisions are more important than incisions. All of us have been taught in our Maulana Azad Medical College, post-graduation, or afterwards also, we have learned that when not to operate. Today also, can you imagine, the discussion is going on that I can do laparoscopy by covering the trocars and gas leak will not be there, and so on and so forth. I think this is very, very important, that are we taking the adequate precautions? If there is an emergency, yes, we have to operate by open method rather than causing a challenge in the post-operative patients. There was a publication recently that if the elective surgery is done in this COVID era also, even 25% of the death rate is possible. So we have to be very, very careful. And again, a very small lesson which all of us had learned is that a split second becomes eternal. What do you mean by this? For example, if I am doing a cholecystectomy, laparoscopic cholecystectomy, and if my attention is diverted. If I'm talking on mobile phone and the distraction leads to disaster, that can be challenging. And now this was the plane, all of us would remember, they had landed in on the river. And why? Because he had taken a split-second decision that he cannot go back to LaGuardia Airport, and he had saved, the pilot had saved all the passengers. All why? Because the decision making was very, very important. I would request our younger colleagues to watch this movie called Sully, and then they would realize that what is the importance of taking the decisions, the timely decisions, the split second decisions. They are very, very important. And I would just comparing why and how we can improve ourselves. For example, do you think that surgery has become as safe as aviation model? If we compare it, the odds of dying in an air crash is 1 in 10 million, and odds of dying in a hospital were of the order of 1 in 300. When I boarded, now I would not say in last 3 months all of us have not traveled, but if when I used to board the flight, then on the, for example, Indigo flight, it was written, and I took the photograph, that flying is a serious profession. Do not carry your worries beyond this point. And this would always ignite me, especially my fellows in Sir Gangaram Hospital and Bhatia Global Hospital. I would always request them that please do not listen to your mobile phones. Switch off your mobile phones or put them on vibratory modes, because distractions can lead to disasters. For example, these surgeons, you can imagine, they are doing the bariatric surgery, but they are playing the match also, and they are seeing the baseball match. So thinking is, no patient should be, why we are losing this trust is because of the attention. And I would say that if, for example, if we have to improve, even if we improve by one step, that will make hell of a difference. Now, in this small poster, one can see that if some work is expected and it is expected to be one, and if I go extra mile and I start doing 1.01 every day, so if I make it into 365 days, that means this is the number. And if I was expected to deliver one, but I deliver 0.01 less, so into 365 days, and this number becomes this. So our thinking is that one should definitely believe on the details. Attention to detail is very important. Today also, can you imagine, in laparoscopic surgery, even Jacobius had told one century back in 1910 that it is the puncture itself that causes risk. But today also, we know, because of the Veris needle, because of the battered abdomen, because of the trocars, still the intestines are being injured, and that can lead to lot of challenges. So thinking is that to err is human, to refer is divine. Especially our younger colleagues, one should not ever deny that if for example, if some complication has occurred, then we should not cover it up. If we cover it up, it is unpardonable. And causing an injury is a mistake. Misdiagnosing is a negligence. Mismanaging is a crime. I would put it in a very strong language. So, for example, if we are doing laparoscopic surgery, please, for God's sake, pray. Then either you are using the Veris needle at the palmer's point, or when you are going in, then the camera person should always be trained in such a manner that all entries and all exits must be shown, and one should not leave any chance for the herniation to develop later on. We should always close all the defects 10 millimeter or more. Can you imagine that this is one of the patients who had been done sleeve gastrectomy outside, and then patient was referred to us and with the repeated vomiting. And when we saw the patient repeated vomiting, we got the CT scan done. We went in with laparoscope, and you can see the aftermath, because the surgeon, the senior surgeon, must have left the abdomen with the younger surgeons, and they must have taken the cannula out just like that. In a split second, it becomes eternal. The intestines are sucked out because of the pressure, and that intestine remains onto the peritoneal cavity onto the anterior abdominal wall, and that can lead on to such a challenge. So thinking is that we should make sure that our younger colleagues also never take the cannula out. This is a small idea, small thought, which I am emphasizing, that every small step matters. I especially tell my younger colleagues, एक भी number कटना नहीं चाहिए. What I mean to say, that when you are doing the surgery, please make sure that no mistake should occur, and we should have learned from the mistakes which have already been made. Remember that life's greatest lessons are usually learned at the worst times and from the worst mistakes. Today is the time. For example, I would put this small video clipping that even if the laparoscopic appendicectomy is being done, but this was a patient post appendicectomy, and the patient presented with pain, abdomen afterwards, and fever, and the fever continued. And when we got the patient, then we got the CT scan done, and CT scan, and we did the diagnostic laparoscopy. And on diagnostic laparoscopy, we found this foreign body, retained foreign body after even appendicectomy. I am always surprised that how the surgeon today, in today's era, would leave such a long rolling gauze inside the abdomen, and the patient continued to visit the surgeon in the post-operative period, but surgeon never got the CT scan done, never had the index of suspicion of whether foreign body has been left or not. That means in the theater also, they were not having that kind of protocol that yes, one has to check, recheck, cross check, counter check, check and check, and then only we will not make these mistakes. Our thinking is whether we take the suture in or we take the needle in, the surgeon has to announce the needle in, suture in, needle out, suture out, and so on and so forth. Then only we will be able to make less mistakes. So again and again, I am re-emphasizing that life wants you to win. Please get out of your own way. Most of us, I would say, these kind of challenges are iatrogenic. We should not believe, we should not have that kind of attitude. No, it is a simple lap chole, simple surgery. No, nothing is simple. No surgery is minor, only surgeons are minor. Surgery is an attitude, and it should be taken in that manner. And I don't know how many of us know what is Kaizen. Kaizen is that continuous improvement. And one small, this is a Japanese word, and it means that if one small step can change your life, if we start analyzing, if we start thinking that how can I improve, how, and only improvement is that I have to introspect. So if I do the introspection every now and then, after every surgery, after my every act, then only I can improve, and then only I will be able to make a difference. I would say, especially for our younger colleagues, that I ask them whenever they come to my hospital, other surgeons also, observers also come to Gangaram Hospital or to Bhatia Global Hospital. I ask them, you want to become good or great? And most of the times, most of the younger colleagues, they say that, yes, we want to become great. But again, I must tell you that I always tell them that to be good, anticipate one step. To be great, anticipate 3 steps. Surgery is nothing but anticipation. If we are able to anticipate, when the why is clear, the how is easy. When we tell our younger colleagues that this is the purpose of using the, for example, exteriorization, and this is the purpose of stapling at that stage. So if they understand that why the intestine has to be exteriorized or why the stapling has to be done, then only they will be following the protocol, then only they will be doing the best for the patient. And how? Now I shall be still devoting slight time that again and again, our thinking is, please, when we are operating, always carry on thinking that will I be able to give my 100%? Am I giving my 100% or not? And if there is any doubt, there is no doubt. Means, for example, in this small video clipping, I would just show that we are doing sleeve gastrectomy. I know that a lot of surgeons from your branch also are doing bariatric surgery. If we are doing sleeve gastrectomy and we are firing the blue stapler, and at the last firing, there will be some surgeons who will carry on thinking that whether I should just apply the clip on this or I should make another staple fire. Again, I tell my younger colleagues, please do not even think. When there is doubt, there is no doubt. Fire a stapler, because all of us know that there is safety in more safety. If we do not fire the stapler, if we save the cost of one cartridge of 10,000 rupees, it will become so expensive for the patient that you cannot imagine. So again and again, there is safety in more safety. Again, talking about the bariatric surgery, all of us know that bariatric surgery, the chances of causing thromboembolism are very high because of their disease, because of their obesity, because of slightly prolonged surgery. And after bariatric surgery, the symptomatic deep vein thrombosis and pulmonary embolism is as high as 6.4%. And bold study also revealed that 73% of the patients can develop DVT and pulmonary hypertension after embolism after discharge. So most of the times, all of us have seen that actual incidence is underreported. And then if the surgeon is on a denial mode, he says, oh, I have done so much of bariatric surgery, not many of my patients have, or any of my patients has had pulmonary embolism. I think he is fooling himself. Pulmonary embolism is found in 8 of the 10 autopsies post-bariatric surgery. So why not take precautions? And precautions would mean whether we give them the compression devices, or we should always calculate the risk factor by Caprini score model. And then we should give either the low molecular weight heparin before, and we religiously continue this for 28 days so that even one mark should not be cut out of all of our practice. And we deal with these kind of patients who are having a weight of maybe 300 kg or more than 300 kg, or BMI of 81 kg. So if I cause a small challenge in one of these patients, definitely the name of the bariatric surgery will go down, and the patient can die of pulmonary embolism on day 7 or day 10 or afterwards. So why not take these precautions in every situation, every case? Why should it not become a protocol? Especially for my younger colleagues, I would put it this way, that can you imagine when Ronald Reagan was shot, he was taken to a small hospital, district hospital, because he was close by. And the thoracic surgeon saw him, and he immediately said that after induction, he told his fellows to open the chest. And the chest was opened, and ultimately Ronald Reagan was saved. Then afterwards, the press, the news media, they asked him that how could it be that the president of the country has been brought to you in a district hospital, not in a major hospital, and still you relied on your fellows or younger colleagues and you asked them to open the chest, and then you took control of the situation. He says protocols must be respected. What I mean to say, that we have been doing it day in and day out with this kind of format. I have 100% trust on my fellows, whether the patient is president of USA or a patient is my father or my sister or my anyone. We have been following this protocol, and that is the reason that we have become safe. So again, I would put it this way, that there is safety in more safety. A mistake repeated more than once is a decision. I think this is very powerful motivation that we should all learn from our mistakes. I am not going into the much details of it, that all of us have seen such kind of patients, such kind of x-rays. Now, can you imagine? Post cesarean, this patient had been going to the gynecologist, same gynecologist, again and again with the pain abdomen, but never ever she got the investigations done. And then when she came to us, we got the x-ray done, and x-ray reveals this, and then we got the CT scan done, and then we went in for diagnostic laparoscopy. And then after doing the diagnostic laparoscopy, we could see the long artery forceps, but it had, by that time, even after 2 years, it had not caused any injury to onto the intestine or to any structure. And that ultimately we could manage the patient well, and patient did well. So what I mean to say, these kind of situations will come, should not come, but they are coming. Similarly, 7 years post hysterectomy, one can see the CT scan, one can see the artery forceps, and such situations are there in periphery, in centers, in major centers also. So again, for younger colleagues, I would say that please, when you go at night, carry on introspecting and carry on. Please read this book by Atul Gawande, the neurosurgeon at New York. He had written that checklist manifesto. And again, for example, in flights also, it has been found that they have the checklist of every small step, and then only the chances of accidents are reduced. In this, they had reported in NEJM also that checklist was found to reduce the rate of postoperative complications and deaths by more than 1/3. So thinking is that if, for example, checklists are not there, and especially our younger colleagues, I would say that please learn from these near miss injuries. The Indigo flight, SpiceJet flight, they were told from ATC that they are facing each other and they are going to collide. But the pilot in Indigo flight had heard, and he read back also that yes, I can see the SpiceJet coming. So if you are, for example, some instruction is given to you, and if you repeat the instruction, that this is the instruction which you have learned and you are now taking care of, that will be the best answer. So thinking is communicate, over communicate. We have seen the pilot and the co-pilots, they are having the checklist, they are communicating with each other, they are checking every point, then they check with the people on the flight also, that please close the door. And she would always announce that I have closed the door and I have cross-checked the other door. Other crew member has also cross-checked, and now we can take off. So that is the way that we will be able to improve ourselves. And I would request our younger colleagues, especially our younger colleagues, that if you want to eat an elephant, how do you eat an elephant? You eat bit by bit. Similarly, how do you do a major surgery? Break them into small steps. And as you must have seen in my YouTube channel also, 10 steps of sleeve gastrectomy, 10 steps of TP, 10 steps of TAPP. So our thinking is that break them into small steps, write the checklist, and then again follow that and check, recheck, cross-check, counter-check. Then only we will be successful. We have been, all of us have seen this WHO checklist, surgical checklist, but how many of us follow that? Our thinking is that we should not copy paste. We should think, we should become the cerebral laborers rather than manual laborers. And there are no mistakes, only lessons. If that kind of attitude is there, then only we'll be able to make a difference. The only disability in life is a bad attitude. If we start thinking that I am now this age and how can I improve? And I have been closing the abdomen with this method only. Why should I improve? I think we will never be able to make a difference. So the thinking is the will must be stronger than the skill. And if we follow that if we have a will to unlearn, learn, and relearn, then only we will be giving the benefit to the patient. And no one can motivate you if you are not willing to do it for yourself. Thank you very much for giving this opportunity to have first ever oration on webinar on Zoom mode. Thank you very much, ASI Nagercoil and Dr. Shiva Kumar, for taking this kind of exercise late in the evening. Thanks a lot. May God bless you all. I know that I had told Dr. Shiva Kumar also, if there are any questions, I will be more than happy to answer them. Thank you very much. God bless you all. Are we together? Hello?
Yeah. Thank you, sir. This is Dr. Sabu. We enjoyed your lecture, oration. It was a fantastic lecture, and we really enjoyed. And your safety is more safety. We really enjoyed it, and I hope many of us and many of the younger surgeons take it up and be safe always. Thank you so much for the oration.
Thanks a lot. Thank you. God bless
Very
you.
much,
God bless you.
Hand it over to the chairman now.
Sure.
Thank you very much, sir, for your excellent presentation. It was very useful to the younger generation also. So now I would like to invite Dr. Siva Kumar to deliver the vote of thanks.
Good evening, one and all. First of all, I would like to thank the ASI branch of Nagercoil for giving us the opportunity to conduct our Siva Hospital oration via this webinar. I express my special thanks to Dr. Muthukarpan, the chairman, and Ajin, the secretary of making this happen. I must mention our deep sense of appreciation for Dr. J. Ebenezer Pensam, chairman TN chapter of ASI, for honoring this webinar with his valuable presence. I shall also express my heartily vote of thanks to our chairperson, Dr. Rubaran sir, Dr. Sadhu Jaisaran sir, for enlightening us with their tremendous knowledge and experience. I consider it as a great privilege to express this vote of thanks to the star of the day, Dr. Parveen Bhatia. I take this opportunity to disclose this, sir. I have always been a huge admirer and fan of your speech, your vocabulary, and many of yours sweep the whole crowd by their feet. I have been waiting so long to bring you all the way down to our hometown. In fact, he was very generous to accept our invitation on the very first call. We had all the arrangement ready to bring him down south, but unlikely due to the current situation, we have limited your speech to webinar. I shall promise to you, we'll invite you for the more grand occasion in future years. Once again, I express my hearty thanks to you, sir. I also thank all my seniors, friends, colleagues, and delegates for being a part of this and making this grand event successful. And I think so, we even all the program of our oration, we never have a question and